My topic is the nutrition and dietetic services in the context of chronic kidney disease, which include this, of course. The aim of this study is to assess the standard of nutrition and dietetic services which is delivered to some governmental and special or private hospital in Jeddah city. Also, we want to emphasize the need or the importance of the enrollment of dietitian to be a part of the medical team for controlling and management chronic diseases. First, I will give brief idea about what is chronic kidney disease. Chronic kidney disease is structural, functional, physiology or abnormality in kidney. It's mainly related to what we call glomerular filtration rate, and it must be more than 3 months to be diagnosed as patient with chronic kidney disease. There are 5 stages of chronic kidney diseases depending on the rate of glomerular filtration rate. Stage 1, there is a kidney damage, but normal glomerular filtration rate. In the stage 2, there is kidney damage with mild glomerular filtration rate. The third one is moderate and very low glomerular filtration rate. The 5th is the end stage of chronic kidney disease, which the patient will be in dialysis or غسيل الكلوي. The prevalence of chronic kidney disease is huge. For example, here, according to a study done in 2008, it is about 8 to 16% of the patients have chronic kidney disease globally. In Saudi Arabia, patients show that with chronic kidney disease, they are about 5.7%. So it is considered as high percent, especially when we look after the complication of chronic kidney disease. What we mean here, the role of dietitian. Dietitian simply is a qualified person who is manage and treat people by using nutrients or diet. According to the National Kidney Foundation, they found that the dietitian is very important member to be involved in the team for chronic kidney disease. Also, the Council of Health Service in Saudi Arabia, they developed clinical guidelines for dietitian to follow in treating the patient with chronic kidney disease. Also, the National Kidney Disease Education Program, they established a summary guideline to assess the patient who has chronic kidney disease and how to involve the diet in their program. The role of dietitian, we have to know that we have a complete medical team to manage the chronic kidney disease. What is the exact role of dietitian? The dietitian maintains optimal nutritional status and monitor nutritional need for the patient. Also, of course, we have that the patient with chronic kidney disease, they have problem with electrolytes and protein. So the dietitian role is to balance the calories, protein, and the minerals in their diet and their body. And of course, we have menu planning. So the patient must know how to use the guidelines to follow to know about menu planning and how to adjust new ways for their condition. And show them how to measure food and fluid correctly. What means that, of course, the patient with chronic kidney disease, he have restriction about taking fluids and electrolytes. So this is the role of dietitian to know how to balance these electrolytes. Also, if we have here every food item, we have food label. Even water, we have food label. So the dietitian role also, she showed the patient how to read the food label in any food items and to calculate it according to her need. They also provide several food lists to show the content of phosphorus, potassium. If you have any chocolate bar or if you have any water here, you can find the amount of the electrolytes on these food items. Also, we have to help combine renal diet with other special diet. For example, if you have patients, sometimes the patient with renal problem or kidney problem, they have hypertension or diabetes or maybe overweight. So the dietitian role is to maintain this diet for all the complicated condition. Also, of course, to slow the rate of progression of chronic kidney disease. These are some examples of the dietitians do for the patient as guidelines to know what is the kidney health, for example, food label, phosphorus here, and kidney test result to know how to read their kidney test results. The materials which I used in this experiment, first of all, we have make a proposal for our research and introduce it to the committee of the ethical committee in applied medical science, and they give us the ethical approval. Also, we have consent form for all the hospitals to be recruited in this experiment. We have questionnaire delivered to all the hospital. It includes questions about the services and the dietetics services provided to the patient to this area. Also, we have oration here, letters from the Faculty of Applied Medical Sciences, Clinical Nutrition Department to be involved. And also we have 12 hospitals involved in this research. It is almost 10 private hospitals and 2 governmental hospitals. The methods which you used here, the ethical approval, as I mentioned before, was obtained from the Faculty of Applied Medical Sciences Ethical Committee. Also, the study design is descriptive cross-sectional study. And the inclusion criteria, all the departments who are agreed to be involved in this the study was included. The data collection, it is one set of face-to-face questionnaire by all the manager in the hospitals. And finally, we did statistical analysis conducted for using Microsoft Office Excel software 2007. The result shows that we found here that almost 60% they followed national regulations, and 25% followed international, and 8.35% followed both. When we asked the hospital about the numbers of dietitians involved in this area, they said that 33% they said that they have only one dietitian in the all hospital. And also 33.3% they said that they have more than 3, and both of them are not enough for chronic kidney disease management. Here we have the governmental hospital. They have accredited by national or internationally. Also, we found that most of them only accredited nationally, but not internationally. Here we have some questions that the dietitian or nutrition education methods. The first one here, counseling patient with poor controlled comorbidity, it is 47%. And we have educate about appropriate calorie and protein intake. They say that about 64%, which is the most one, and 52% is about how to manage their weight for the patient with kidney problems. Unfortunately, here we have asked the departments that if they're acknowledging dietitian to be as important member to be involved in chronic kidney disease management, 75% it is okay, but still there is 25% said that they can, okay, 25, I must be finished, okay. 25% said that dietitians is not important in the role of management. Oh, so not all dietitians are member of Saudi Dietetic Associations, and this is not fully aware of the accreditation status of their dietitian. Some hospitals, they did not know that if their dietitian are accredited or not. Also, they other mentioned this following the national guidelines for optimizing a patient nutritional status. Implementing nutrition education for pre-end-stage kidney disease patients is critical to delay kidney disease. All this discussion, to save time, okay, is to emphasize the role of dietitian in management of chronic kidney disease. We have to develop some policies and guidelines to standardized nutrition services to provide for patients with chronic kidney disease. Also, there must be periodic evaluation for all the hospitals to know if they have the high standards of accreditation. Also, if we look after all the chronic disease cost effectiveness, there must be dietitian to reduce the side effects of the disease. Although, as we know that dietitian has very important role in preventing and treating many chronic disease. To conclude that we have any chronic disease must have a team or medical team. I will just do it here. For health care team for chronic kidney disease, we have, of course, the general practitioner is very important. Also, we have the renal coordinator, which will show the patient how to follow their condition. Also, we have medical social workers to socially help the patient, and the nephrologist or the human or the doctor who is specialized in kidney diseases, and also the pharmacist to show the patient how to use their medication appropriately. And finally, of course, the renal dietitian. To complete the picture here, I have to say that renal dietitian is very important to be involved in any medical team for chronic diseases, and the need of diasporic engagement. This is not only in Saudi Arabia, but also in Sudan. We have many dietitians abroad, even in Saudi Arabia. There are many Sudanese dietitians. One of them is Dr. Najat is here with us, and they are involved, but we are diasporic. And thank you for listening.